Hello, it's Dr. Rhonda Johnson. Today is Sunday, March 7th, 2021, and my message today is all about hanging in there. Folks, we've all got COVID-19 fatigue. We all want this pandemic to be over. We want to get back to life the way we used to be, right? Well, we're going to have to hang in there. We saw this week Texas, Mississippi, Iowa, Montana, and North Dakota lifted their statewide mask requirements. And they're joining 11 other states that never required face coverings statewide. We saw news stories of about 100 demonstrators who were burning masks in the state of Idaho. Now, we know that 100 folks don't represent the majority, even if we were saddened, some of us, to see this. It is my hope, and this is why I'm doing this message today, that people in all states and all nations who've been impacted by this coronavirus pandemic will keep practicing the things that we know work. These are the simple prevention strategies, such as wearing our face masks, washing our hands, staying home if we're sick, and staying more than 6 feet away from others. It also includes avoiding crowded indoor places where we're exchanging air with strangers. The coronavirus remains a major public health threat. The United States, 1 week ago today, recorded 87,000 new cases, and this past week, on average, more than 67,000 people were diagnosed with COVID every single day, according to the CDC. And sadly, this past week, between 2,000 and 2,200 people died every day. Those aren't just numbers, folks. That's someone's mother, someone's father, someone's sister, brother, or grandparent, or children who are dying from this virus. We know that people with obesity, high blood pressure, and diabetes remain at higher risk for complications from this virus. We know that here in the United States, life expectancy dropped 1 year in 2020 overall. But for Black Americans, African Americans, life expectancy decreased 3 years. That's the first time this has happened since the turn of the century. We've lost so many lives from this pandemic. Our country has been devastated, more so than any other country in the world. We're 4% of the world's population and more than 20% of the world's coronavirus deaths. So let's continue to stick to the basics, folks. Remember, there's no cure for this virus, and there's only one approved drug which has to be given in a certain window, and that's remdesivir. We're making great strides with vaccination against COVID-19, and that's just part of the prevention strategy. Now, I also want to put in a plug for keeping up with your healthcare appointments. Experts are saying control of blood pressure here in the United States is getting worse. And that's not good because 1 in 3 adults have high blood pressure in the United States. Cancer experts are saying that cancer outcomes are getting worse because people aren't getting the care for their chronic conditions. And child health experts say children are not receiving their routine well child visits and their immunizations. So I'm asking you, please, this month of March, schedule an appointment to see your healthcare provider. Schedule an appointment to see your dentist. Schedule an appointment if you have children to take your child to the doctor. And as always, continue to practice prevention and be ready to get your COVID-19 vaccine when your appointment in the line comes up. As always, my views are my own, and my only intent is to help save lives. Have a blessed day, folks.